Respiratory volumes and capacities. Respiratory volumes and capacities. Yesterday I said that. Okay, so the pulmonary activities can be measured by using spirometer. The spirometer helps in clinical assessment of pulmonary activities. Clinical assessment. Okay, so clinical assessment means all the activities of the pulmonary respiration can be measured. Okay, so for that they will use spirometer. Through spirometer, the respiratory volumes and capacities, our lungs, how much they can take, how much amount of air they can take, how much amount of air they can expel. So that is what it is medicinally. Doctors, the person who are using spirometer, so using spirometer, so this they can be calculated. Okay, so respiratory volumes means what? Breathing volumes, inspiratory, expiratory. And our lungs capacity, how much of our lungs capacity, how much it can take, normal conditions, forced breathing time, normal inhalation, normal exhalation, forced, normal, like that. So during normal expiration, inspiration, or forced breathing, how much amount of air we can take? That's what we can discuss. It is no one can say exactly it is exactly this much only. I may take some amount of oxygen. Others may it may vary from person to person. But so the respiratory volumes and capacities can be measured by using spirometer. Can be measured by using spirometer. Okay, so among these different capacities of our lungs now we will keep discussion. First one is the tidal volume. Tidal volume. In this one, volume of air inspired during inspiration and expiration is called tidal volume. The volume of air inspired or expired during inspiration and expiration is called tidal volume. It is commonly 500 ml of air per minute. The volume of air inspired intake and expired release during normal inspiration and expiration is called tidal volume. It is 500 ml of air per minute. That is healthy man can breathe, can inspire or expire approximately 6,000 to 8,000 ml of air per minute. 6,000 to 8,000 ml of air per minute. Healthy man capacity. Okay, so when we are consciously sitting, we can take more and we can release. This is called tidal volume. The volume of it. This can be measured using spirometer. I cannot measure. No one can measure. Okay, so who is anatomical doctor? So those members can measure, can identify the tidal volume. The volume of air that can be inspired, that can intake or release during inspiration and expiration is called tidal volume. It is 500 ml. It is approximately 500 ml of air per minute. That is healthy man. Healthy man. Approximately can inspire or expire 6,000 to 8,000 ml of air per minute. Next one is inspiratory reserve volume. Inspiratory inspiratory reserve volume. The maximum volume of air that can inhale during forced inspiration in addition to the tidal volume is called inspiratory reserve volume. Inspiratory reserve volume. The maximum volume of air. The maximum volume of air a person can inhale, intake during forced inhalation is called inspiratory reserve volume in addition to the tidal volume. This is approximately 2500 ml of air, 2000 to 3000 ml of air per minute. Approximately it is. Okay, that's all. See here in this one, the maximum volume of air a person can inhale during forced inhalation. The maximum volume of air a person can inhale during forced breathing, during forced inhalation. Inhalation means intake. In addition to the tidal volume is called inspiratory reserve volume. It is approximately 2500 ml to 3000 ml of air per minute. Okay, that's all. Okay, next one is expiratory reserve volume. The maximum volume of air a person can exhale, release, exhale, exhale or release. The maximum volume of air a person can exhale or release during forced exhalation, during forced during forced exhalation. That's exhalation. Okay, so it is approximately 1000 to 1100 ml of air per minute. Okay, ma? That's expiratory reserve volume. The maximum volume of air, a person can release out, exhale during forced exhalation or release. In addition to the tidal volume is called expiratory reserve volume. It is approximately 1000. Okay, so it is approximately 1000 ml to 1100 ml of air. Next one is residual volume. The volume of air. See here. Volume of air means what here? In our lungs, how much quantity, how much amount of air remaining in the lungs even after forced inspiration. Forced inspiration means what? This is called forced inspiration. Forced exhalation means what? Releasing forcibly, taking forcibly. The maximum, the volume of air remaining. The volume of air remaining in the lungs even after forced expiration. Okay, one inhalation. After exhale, after releasing, how much amount of air is present? However, forcefully we will release the some amount might be there. That is called residual volume. That is called residual volume. This is approximately 1200 ml to 1300 ml of air. 1200 to 1100 it is. 1100 to 1200. 1100 to 1200 ml of air. Okay, so these are all tidal volume, inspirated reservoir volume, inspirated reservoir volume, residual volume. I said 1100, 1200, 1100, 1000. It is not accurate. We cannot say numbers exactly. No one can say that. Negligible. That's why every moment I use approximately. If you see any another reference book, there are thousands of reference books are there. From one book to another book, one book to another book, this number varies. Okay, so this is actually up to now, even one time also for board exam, they did not ask question. But the objective discussion, chances to ask. Okay, objective discussion. So for the sake of objective discussion, so from this corner, some bits previously asked in final exams. Because of that, I am saying here no logic. So from here to here, you have to by heart completely. Okay, so what is tidal volume? During tidal volume, what are the breathing processes? Like that question. During tidal volume, breathing inspiration, expiration. During normal, inspiration and expiration. Okay, inspiratory is the volume. Inspiratory means inhalation. Maximum volume of air a person can inhale. Expiratory, exhale. Residual volume, the volume of air remaining in the lungs, even after forced expiration. Forced expiration. These words, whether it is inspiration or expiration, some condition we may forget. However, we will study. So some conditions, expiration place inspiration will write, inspiration place expiration will write. That's why I'm saying pinpointedly you have to by heart. Then only you can remember and keep answer. Okay, ma? So this is next. Next, still. Next, inspiratory capacity. Inspiratory capacities. The volume of air a person can inhale. Volume of air. A volume of air a person can inhale. A person can inhale even after normal expiration. Even after normal expiration. See, so the volume of air a person can inhale, can intake after normal expiration. That is called inspiratory capacities. Inspiratory capacities. Okay, so it is approximately 2500 ml of air to 3000 ml of air. Okay, that is called inspiratory capacities. Once again, volume of air means how much amount of air? The volume of air, inhale, intake. A volume of air a person can inhale even after normal expiration. See, inhale. After normal expiration, how much we will take inside? That is called inspiratory capacities. That is approximately they are saying that is 2500 ml to 3000 ml. In between this may be decrease, may be increase. We cannot say exactly. Okay, that's all. Next. Next. Functional residual capacities. The volume of air, volume of air, volume of air remains in the lungs even after normal expiration. It is called functional residual volume. The volume of air remains in the lungs after normal expiration. That is called functional residual volume. Okay, the volume of air remains in the lungs after normal expiration. That is called functional residual. Volume of air remains in the lungs after normal expiration. That is called functional residual volume. Okay, next. Vital capacities. Last but not least, the maximum volume of air a person can inhale even after forced expiration. That is called vital capacities. The maximum volume of air that a person can inhale even after forced expiration. Forced normal expiration, forced inspiration. Forced inspiration. Sorry, not here. Forced expiration. The maximum volume of air a person can inhale into the lungs even after forced expiration. That is called vital capacity. Last and final. Total lung capacity. So the total volume of air remains in the lungs at the end of forced inspiration. At the end of forced inspiration. That is called total lung capacity. Okay, so the volume of air remains in the lungs at the end of forced inspiration. That is called total lung capacity in every study heading. So whether it is inspiration or expiration, that we have to remember. So these are all the study headings. 1, 2, 3, 4, 5, 6, 7, 8. In these 8 total lung capacity. Okay, ma? So these 8 you have to remember. So the total lung capacity. See here. See the total volume of air accommodated. The total volume of air accommodated. Accommodated means remaining in the lungs at the end of forced inspiration. That is called total lung capacity. The volume of air remains in the lungs or accommodated or settled in the lungs after forcible inspiration. See now our total lung capacity. In that time, how much amount of air accommodated, settled in our lungs? That is called total lung capacity. Okay, so these are all 8. So for every heading, definitely we will get confusion whether it is inspiration or expiration. Common. Okay, however we are studying. So commonly, just in mind that much minutely we cannot remember, even though it is mandatory. for objective discussion. In board exam, even one time also they did not ask question, but objective discussion they have asked it. Okay, so in the place of whether it is forced respiration or forced expiration, that it gets confused. But thorough reading, by heart, number of it meaningfully thorough number of times if you read, you can read. Okay. Exchange of gases, next topic. Types of exchange of gases. Alveoli are the primary types of exchange of gases. Alveoli are the primary sites of exchange of gases. Commonly, the exchange of gases occurs between exchange of gases. Exchange of gases occurs between blood and tissues. Between blood and tissues. Alveoli are the primary sites of exchange of gases. The exchange of gases occurs between blood and tissues. So the oxygen and carbon dioxide is the major gases. Exchange occurs in between these by oxygen and carbon dioxide are the major gases. Exchange occurs in between blood and tissues. In between blood and tissues by simple diffusion. By simple diffusion. See, so exchange of gases occurs between blood and tissues by simple diffusion. By simple diffusion. So the diffusion of gases depends upon the concentration gradient. See, diffusion of gases depends upon the concentration gradient. So the simple diffusion depends upon various kinds of factors. So those factors are favorable, then exchange of gases between blood and tissues occurs effectively. Okay, so the exchange of gases occurs depends upon some factors. There are some factors will facilitate the diffusion. Those factors partial pressure. Okay, exchange of gases depends upon some factors. If those factors are effective or available, then those will facilitate diffusion process effectively. Diffusion of oxygen and carbon dioxide between blood and tissues. Okay, so first factors are partial pressure. Partial pressure. What is partial pressure? The pressure is contributed by individual gas in a mixture of gases. Is called partial pressure. Partial pressure means what? Pressure, a kind of a pressure is contributed. A kind of a pressure is contributed in an individual gas. In an individual, this gas contributes pressure. This gas contributes pressure. This gas contributes pressure. So gases in a mixer, in a group of gas molecules, individual gas molecule contribute pressure. That is called partial pressure. Partial pressure. Once again, the pressure is contributed by an individual. The pressure is contributed by an individual gas in a mixture of gases is called partial pressure. If each gas, individual gas molecule is provided pressure, then the diffusion process occurs actually. Okay, so the diffusion of gases, exchange of gases occurs by simple diffusion by some factors. Among those, first factor is partial pressure. Second one is solubility. Solubility of gases. Solubility of gases. Solubility means if the gases are soluble, if the gases carbon dioxide and oxygen is soluble in the blood and tissues, then diffusion process occurs. Solubility of gases. Thickness of the membrane. Diffusion process depends upon thickness. So, if the alveolar membrane is thin, very effective for diffusion of gases. Alveolar membrane is thin, it is effective for diffusion of gases. Okay, thickness of membrane. Surface area, it is in float I wrote like this way. So it is U, surface area. If more alveolar membrane is if it has more surface area, diffusion does not. Diffusion occurs in short distance only. Okay, surface area and distance of diffusion. Distance of diffusion. Distance of diffusion. If more distance, diffusion process does not occur. Diffusion process are very effective in short distance. Okay, if these all the factors are favorable, then exchange of gases occurs effectively by simple diffusion process. Here, one more question they will ask. What is partial pressure? What is partial pressure? The pressure, partial pressure. What is partial? The pressure is contributed by individual gas molecule from the mixture of a gas is called partial pressure. So, partial pressure for oxygen is represented into PO2. The pressure, partial pressure is represented for oxygen is PO2. For carbon dioxide is PCO2. Partial pressure of carbon dioxide is PCO2. Partial pressure of oxygen is PO2. Okay, so that's all. If these are all favorable, then exchange of gases occurs between blood and tissues by simple diffusion. Okay, ma? So this is the explanation of exchange of gases. The topic was not finished. Okay, so this